My name is Grace Baba and I'm a nursing student at Cedarville University. Today I'll be doing IV insertion and then I will discontinue the IV later. So I begin by entering the room. I perform hand hygiene and I'll provide privacy for the patient. I'll introduce myself and ID the client. So you might tell me your name and date of birth. That checks. I'll look at the physician's orders, explain the procedure to the patient, ask any questions that they might have. And I will have my supplies prepared. I have the syringe of normal saline. I have the lock device and the tubing. So making sure that this all stays sterile, I'm going to connect the lock device to the tubing, sterilize the hub, connect it to the syringe, like so, and then put that to the side so I can use it when it is time. Okay, so I come in and I wash my hands and I will look for a site, and this vein looks good to me. So I'm going to apply the tourniquet, and this can't stay on for more than 2 minutes. Nice and tight. Okay, and then the chlorhexidine, crack that back and forth motion for 60 to 90 seconds. While I'm waiting for that to dry, I'll apply my gloves. And now it is time to introduce the catheter into the injection site. 10 to 30 degree angle, bevel up. And I'll reduce the angle as it goes in. Watching for flashback, I'll take my 2x2 gauze, hold that in place, release the tourniquet, remove my gloves, secure this in place.
I can go back there. I don't care. It doesn't matter to me. There were 3 back there at one point.
Apply the Tegaderm.
I'll just come over if I have any really pressing questions.
I would have connected this before I taped it in place.
I don't know. Maybe.
And I'll apply the Tegaderm, and I will date, time and initial, and then I will secure this in place. And now it is complete. And then I will receive the doctor's orders to discontinue. So I'll come into the room, again wash my hands, identify the client, introduce myself, answer any questions that they might have, and just explain what I'll be doing. So I remove the tape, loosen the Tegaderm, loosen the tape, and then I will apply my gloves. And with a clean 2x2 gauze, I'll apply light pressure on the site and then remove in the same direction that it was inserted. And I will inspect the catheter for intactness. Looks good to me. I'll apply light pressure for 2 to 3 minutes and then apply a Band-Aid, and the patient should be good to go.